15 years ago.
Highly stressed out.
I went on a bit of alcohol.
This is a resource for trainee psychiatrists and their trainers and other members of the multidisciplinary team. We hope you will find this training resource useful. The film takes you through the patient's and carer's journey, from first contact with psychiatric services to recovery and coping, with examples of people's personal experiences at each stage. The film can be paused at different points to allow for group discussion and includes some key principles.
Fifteen years ago.
I was at university at the time.
I went on a bit of alcohol.
Who suggested you should see a psychiatrist?
I suggested I need one. Friends suggested I needed one.
My GP usually refers me.
I'd been in the care of my GP for about 18 months and he was having difficulty coping, so he suggested that I then see a psychiatrist.
I tried to kill myself and that's how I got involved in the system. That's during the hospital, and I saw a psychiatrist there.
I asked to see a psychiatrist myself.
I went up to the local drug and alcohol centre and they had a psychiatrist there.
My wife put me in touch with a psychiatrist.
How did you feel about that?
Well, at the time I was so dazed and confused. I was in the sort of state that you could have suggested anything or done anything and he wouldn't have bothered me.
Very frightened because I didn't know what was going on.
Nervous, very nervous. I actually went on the run when I knew they were coming to see me.
I was resisting in every way. I wasn't happy at the time. I didn't know that I needed help.
I think at the time I was sort of just thinking about getting back to get my degree at university, and it was like anything that would get me back.
Words can't explain, but very bitter. Very bitter.
I was relieved in a way because it was felt by the GP and myself that he couldn't really help me much more with my mental health problems.
What were your impressions at the first meeting with the psychiatrist?
I didn't know it was a psychiatrist for a long time.
I found the fact that the psychiatrist sat behind a desk was a barrier. The fact that he didn't stand up when I entered the room, which I thought was lazy and bad manners.
Very reassuring that someone was listening to me.
I wasn't very comfortable lying in bed naked with the psychiatrist and wanted to talk to me immediately on waking up.
He listened very attentively to what my story was.
I was quite uncomfortable. I felt quite judged, I felt quite analysed.
I found him very unprofessional, that he would make answering calls during my session. He'd walk in and out of the room, so he didn't seem to have any courtesy, or I found him very disrespectful. He didn't imply the equal opportunity policies towards me.
Anxiety, fear, but joy that I was going to be helped.
When I went there, he was all right, and he just asked me as a friendly question.
He said, your depression has been brought on by alcohol, and I said to him, that's not quite correct. I started drinking because of the fact that I was depressed, you know.
He was very detached, very clinical, very scientifically correct, very professional. I wasn't too comfortable, but I just went along with it because I thought he was doing his job.
How did you feel about being admitted against your will?
That was quite scary because it was in quite a bare room,
actually in the hospital with a doctor and I think a social worker firing all these questions at me and really not feeling in control. I felt very alone and very vulnerable.
I didn't have no choice. It was all happening to me all at once.
I still have the handcuff marks, which I was being restrained and it was cut to the bone with the handcuff. And for that to be your first introduction into psychiatry, I thought that the whole world was against me, a conspiracy of some sort.
You don't know why.
Were there things that staff did that helped you?
I think the staff that helped the most were the ones that made time for me. It was as basic as that. It was coming up to me in the corridor and asking how I was and giving me a value, and rather than being in their staff room.
2 or 3 of the nurses I found very open-minded. They reassured me that it was quite normal to feel like the way I was feeling.
Were there things the staff said or did which made you feel worse?
They never told me how long I was going to be there for.
We had no say in anything. There was no patient choice, no patient involvement in our treatment or care.
And I woke up late that night and I went to the manager's office and I said, excuse me, yeah, I think you got the wrong person. There's nothing wrong here. You know, my clothes, I need to go home now. And then she pressed the buzzer underneath her desk and I saw 4 big blokes run down the corridor at me. They ran down at me, got me on the floor, held me down, twisted my arm. I was fighting for my life. And then they injected me with tranquilizer. And then all of a sudden my body went funny, you know. I collapsed, I went into a coma and I woke up 4 days later.
How did you feel when you were admitted or started to receive home treatment?
I must admit that when I first go into hospital, the feeling of getting inside those crisp white sheets is really a haven for me.
It was a bit of a relief. It was safe. I felt safe and quite comfortable that someone was taking some note of the problem.
2 people would come every day, but they were different every single day, so it meant that I felt I had to explain everything over and over again.
I was given a nice thing to do and I was consulted with what I wanted to do, and I ended up working in the gardens, and I found that to be the most rewarding of any activity that I've done.
Can you think of some of the benefits about being in hospital or having home treatment?
The good thing about being in hospital for me was only that I had found a temporary escape.
The benefit of being in hospital is that when I'm extremely ill, that's where I need to be to keep myself safe. If I hadn't been admitted to hospital, I would have starved.
I had an excellent psychiatrist. He was very helpful. One of them, like for example, you know, you have to fill in for your bus passes and forms, you know, the DWP write to you about your mental health status. And I did find that he was helpful. He was from an ethnic background. I found the ethnic one was much more helpful.
I finally got my space from my family and I had the break, you know, to sit there and think about how I had behaved.
There's definitely a benefit of being in hospital where you have access to people who have expertise in mental health, but quite often those experts are actually the fellow patients that are in the ward with you at the time.
One of the good things was a particular nurse who used to sort of take the time to sit down and talk with you.
I think staff were helpful. I think listening and trying to make it such that I could go back home where you're in a much more relaxed atmosphere, where you're used to things being where they are, which for my condition is very, very helpful and very therapeutic.
Well, I've had some very good help at home, particularly when I was discharged the following year, I lost my father, and my CPN recommended a counsellor to me.
The good things about getting my treatment indoors was the benefits of that was that my privacy and I could talk to my key worker without anyone disturbing us, and to make my points over to him so he can understand me and I can understand him.
Are there things the staff did or said which didn't help and made things harder for you at the time?
Until quite recently, if I was an inpatient, there was never anyone to talk to except the cleaners.
The staff very soon picked up on the fact that I wasn't going to be a talker and I wasn't going to open up. And for some reason, they suddenly became very combative about the things they would ask me and I would reply. And it seemed that everything I said about, as far as I could say, as far as they were concerned, it was wrong.
I have had a particular nurse shout at me when I've been crying to pull myself together.
There was a bit of an attitude of, well, you're a mental health nurse, so you'll be able to treat yourself.
I always thought they were going to put me away forever by the way the terms they use, the words they use. You just think you're going to get thrown away, the key's going to be thrown away. What's happening to you is happening just to you. But how they spoke to you, well, it varied depending on who was talking to you. If they didn't have skills in how to talk to you, then you had to ask a dozen times what they mean. What do they mean? You know, you never got a clear answer.
I found the nurses very professional. They were usually quite detached, and I also found they made use of sometimes double meanings in words, and you know, as if to encourage you, but really just how to put it, just to trick you into answering something or something like that. Yeah.
Did you feel you had enough information about what would happen at your review meeting?
I had no idea what the meeting would involve, how many people would be there, so I walked in blind.
You were just sat waiting, and then you'd walk into this room and you'd just see a whole lot of people sitting there.
You see all these different faces. No one spoke to you before.
They all asked lots of different questions from different angles.
And then these people are making decisions of your life. You know, just based on a few scribbles that has been scribed on a bit of paper.
I had very little information about what would happen at my review meeting, and I can't recall being involved or invited in. If I was invited in, I would only be invited in at the conclusion of the meeting to be told this is what the outcome of the meeting, this is what the meeting has decided.
Have you any comments to make about how your reviews could have been done better?
One thing, I could have been warned that there'd be so many people there, and possibly even as the psychiatrist had seen me a few times, and say one of the nurses who'd seen me virtually every day, they could have made a report to the others that were there, and they could have made a decision rather than me being confronted by all of them.
Before the actual meeting, it would have been nice to know who to expect at the meeting.
I think having some forewarning that there's going to be these 15 or 20 people present, having time to think about what you're going to say and what the questions are being asked.
Lots of things were explained to me, lots of things, but if I understood them at the time, I don't think so.
Well, I thought that there were too many people. I really did. I thought there were sometimes 8 people in there, and that was really just too many. And I couldn't get my point across because I didn't feel confident enough to say it.
I think if more information had been given about who was being involved in my care plan and which sort of partnerships were being formulated around my care, and that would have helped to have been given that information and felt included, even although I wasn't there physically in the meeting.
They could have sort of invited me in and asked me questions about my care and about my attention.
What sort of help would you have liked to get more benefit from the reviews?
Unfortunately, I don't have any family or friends that are interested in my life enough to care. It would have been nice to have had an advocate, but again, for me, there would have been issues on trust.
I think probably if you had more say in who came to the review meeting.
Certainly when I was still forging a relationship with a consultant, then it would have helped for somebody to have given them the picture of who I am when I'm well, rather than when I'm in hospital and not well.
I think the review could have been done better by speaking to me prior to the review and then including me within that review.
The use of advocates or having others who have been through the system prior to oneself or whatever, but you must have someone there independent, because it's a very daunting experience for someone that has never come across before.
Definitely, if I had a friend who knew me really well, to know the real me, I would have liked that, because I felt all alone and I felt like an easy target.
Somebody that can sort of take your put your hand in and hold it whilst you're it's all good.
How did you feel about the prospect of going home or being discharged from home treatment?
Well, once I got told to go out of the hospital and into my own home, it felt kind of weird going home. I got so used to living in the hospital.
The prospect of going home was just as terrifying for me as staying in the hospital.
I was pleased to go home, but of course I didn't know why I had been there.
I attended a recovery unit for 6 weeks, and at the end of my 6 weeks I was discharged with no follow-up care, no support, nothing. I actually asked to see somebody the day before I left, and had I not done that I would have left without an exit interview, so I was just discharged with nothing at all.
The feeling and the anxiety of wanting to go home started from the first day that they took me in. So it could have been better, but for going home and trying to explain to nurses that part of my problem was being back at home and then to be sent home only to be returned because of the situation. No one was making sure that once I got home, was I going to be getting the care that I needed in keeping my mind sound to stop me going back into the hospital.
When you leave the hospital and you've been there some period of time, you tend to lose a lot of your independent ways of doing things, and I think what you need is a plan to support you once you come out of hospital.
Are there ways this could have been handled better by staff?
There should have been a discussion with myself, with my family, and with whoever I was being referred to out in the community.
They could discharge me. They say to me, go to the GP if you have any difficulties, but they could have given me someone I could contact.
Yeah, and I think there should be far more consideration as to the impact of that sort of discharge date to prepare you for it and to make sure that the structure and community is there to support you when getting out of hospital.
I thought my discharge could have been handled better by staff if they let me do things for myself and talk for myself and not tell me what to do and tell me how to be when I leave the hospital.
Before you actually discharge, or maybe on the day or before, they should have a plan for you, how you're going to cope in the community, contacts that you can make, support you can expect from the CMHT, Community Mental Health Team, which is absolutely vital when you're making that transition from coming from the hospital, which is a lot different atmosphere to going back home.
By finding out the needs that I will, there's no other big sentence or word, it's the needs to support me at home and being part of a community.
How did you feel about the continuity of care you received over the discharge period?
Well, in actual fact, it seemed more like discontinuity. Nothing seemed to flow.
I've had poor continuity when I've had different care coordinators who haven't contacted me, but then I've had brilliant ones as well. So it really depends on the level of their skill, their expertise, their understanding of situations.
It's been very disjointed in terms of I've had so many psychiatrists change in the space of a year. They don't seem to stay. There's not a continuity of care, and then it makes you feel uncomfortable as a service user because you've got to build up that trust again.
It was nice to know that there are people out there who care and they weren't just going to leave me to my devices in case I did go downhill again.
I didn't get any. I just started going to, what was it? I started going to the AA once a week.
Well, the continuity of the care turned into a big support. It was a very, very nice support indeed. I mean, I'm going to Lake District this year. Gonna go over there and do some drumming and some canoeing, and it's like all for free, and it was through the care of the family Mosaic who gave it to me. And hopefully there'll be more and more being done of this.
Do you feel able to cope with your illness in the future?
I've got engaged. I've got a long way to go. And love is a big thing.
Now I know what I'm dealing with, yes. I mean, back then I didn't, but now I do. I mean, I was even sent leaflets from the social worker at the hospital. I even got books and read up on it. I've got all the help I need. Yes, I've learned to cope with it.
I think I'm better able to cope with the illness because I now have a diagnosis of what it is.
I tend to think of my illness in the present moment, and what's happening now is what's important, not what's happening in the future.
Unfortunately, because of the one line in my medical report that says I will successfully kill myself, when I feel down, I feel this is what people expect me to do. And I find that quite an obstacle to overcome.
Yeah, I've developed a huge self-awareness from being unwell and having gone through the process of recovery. which I'm still undergoing and believe I'll be undergoing the rest of my life.
I do feel better able to cope with my illness because I recognise the signs a lot more.
I've developed a really good insight into both myself and my own personality, but also how my illness manifests itself.
My spiritual faith has helped me a great deal, not medication, not the psychiatrist, my spiritual faith, praying, meditating, socialising, because you're not so cut off, I think they need the day centre, you need others to interact with.
Do you have worries about how people see you because you've received psychiatric care?
I was lending a hand to on a trust event. They had a stall down the local hospital. Amongst others, there was ones for cardiac units, mental health unit, you name it, it was all there. And people were going around looking at the leaflets on the cardiac unit. They'd look at the stand and go, oh, cardiac healthcare, that's interesting. And they start going through the various leaflets. They got round to the mental health unit, looked up. Sept, what's that? Oh, mental health. Ugh. And they hastily backed away. Lack of understanding of mental health is about the worst problem that we have, because it's no different to having cancer, flu or anything else. It's an illness.
Through having a photographic exhibition with some of my poetry, I decided to go public 3 years ago when I came out of hospital and say that this exhibition was actually the visual expression of my recovery from severe depression. And I was amazed actually at the floodgates that opened up, that openness, by going to the local papers and in the gallery, because people came up to me and said, my husband's been depressed for 5 years, my daughter has, I have. And I realised how commonplace it is. It's just that people have internalised stigma. And by overcoming my own, I've managed to bring it out into the open.
People in the street don't know. But when I do reveal to the odd person, because I'm a community volunteer, talking to people all the time, when I see they've got a disability, I then say to them, do you want to hear something? They go, yeah. And I tell them, I'm a paranoid schizophrenic. What? You can't be. No way. Oh yeah, I've been depressed for about 16 years.
I just get on with my life. That's it. I don't bother what everybody else thinks. It's what I think.
Are recovery and cure words that have meaning for you?
At the moment, I know there is no cure. Recovery, not sure I would use recovery. Controlled, stable, I think, but not recovery, and particularly not cure.
Well, I mean, if I got cured completely, it would be a miracle. And I wouldn't mind a miracle occurring, but I would say I'm more heading along the lines of very, very slow recovery.
Recovery takes a long time, and it's really like a huge piece of research into who am I and what am I about, why am I here.
What final messages would you like to give to doctors and other members of the team using this resource for their training?
Please don't sit behind a desk. A desk is a barrier. Remember that we are people with feelings that run deep. Treat us as a person, not the diagnosis.
I would like mental health professionals, and particularly psychiatrists and consultants, to accept that not everybody is able to talk about the problems they have and will have other ways of exploring their emotions.
Well, it's always difficult, I find, at times, to speak to psychiatrists because they're self-motivated. They've got their own insight as to what they want to do, and that's not a bad thing. But I think they should stop a wee bit and say, well, if I was on that side of the fence, how would I like to be treated?
If psychiatrists could try not to patronise people and make them feel like objects.
Spend a bit more time with the person. Doctors in 15 years that I have been under psychiatry, no doctor has spent more than an hour putting all the times together.
That was very dramatic, really, because my daughter was previously in hospital on and off for 2 years. That was in the hospital. This last patient, she's been no longer accepted.
How did you feel about the way the person you care for was identified and given an assessment?
I've been trying to get him to have an assessment for going into hospital because he just wasn't, he was bizarre, peculiar. We saw about 10, oh, I think that's a slight exaggeration, saw a lot of psychiatrists right through the system. Each of them had a different diagnosis for him, and each of them said he wasn't ill enough to go into hospital.
How did you feel about your involvement in this process?
I still feel that they should speak to me more.
What could the psychiatrist or services have done better?
The most important thing for anybody caring for anybody, irrespective who it is or what illness they have, is the information. My daughter was put on high doses of medication. I didn't know what this medication could do to her body. That's important.
That was very dramatic, really, because my daughter was previously.
What was your experience of the admission or sectioning process?
I haven't had a cup of tea. There's been no communication from a nurse. I haven't been given when the times of the wards are open for visiting. What will be the next step in my daughter's care?
How are you involved in the admission process by the mental health staff?
As soon as she was admitted, they were involved all the time. They come to the house regularly, keep in touch. We go to the meetings, they were at the meetings all the time.
While the person you care for was being admitted or sectioned, what support or information were you given?
I personally had no support whatsoever. My son had a CPN, but his concerns seemed to be just with my son. I wasn't included.
During this time, how could the psychiatrist or team have supported you and the person you care for better?
Get involved with your patients, get involved with the carers, and most importantly of all, because I know from experience, if you get a man or a woman who's ill, who goes ill and you've got kids, get the kids involved at a young age, tell the kids about the illness, how it affects your mother.
That was very dramatic, really, because my daughter was previously.
How did you feel about the way the professionals conducted the review? How could this be improved next time?
And there I sit all on my own. My daughter's got her CPN at the side of her, and she could have had an advocate if she'd have wanted one. And she sat there and they were all asking her questions, and she's absolutely petrified, as I am. I've never seen so many people in the room. And when I ask a question, they all look at one another as if to say, oh, this person actually speaks. But who is this person? In fact, they even asked me, who are you?
How are you involved in the review process?
They would ask me how I felt about what they were doing, or how did I feel he was getting on. But, you know, when I said, well, he didn't seem to be too well, it seemed to be just shrugged off, and that was it. So I didn't feel that they were taking any notice of what I was saying.
How would you like to be involved in the future?
Well, for a start off, I would have liked an invitation, and then I would have known that I was accepted in that review. I would have liked somebody with me, i.e. like a CDSW, to be with me, to support me instead of being on my own.
That was in the hospital.
From an unknown place.
How were you involved in planning for the discharge of the person you care for?
It's up to the judgment usually of the psychiatrist to decide whether they are well enough to come home. And I've had a debate with a psychiatrist and I said, I don't think she's well enough to come home. And it was his opinion very firmly that she was, so we took her home. On one occasion, we were out for a walk and she leapt in front of a car.
What support or information was given to you when the person you care for was discharged?
I didn't get any support at all. There wasn't anybody I could phone in particular. I had no names of anybody. I hadn't got a phone number. I hadn't got any information on how many times she'd got to take a medication.
How could the process of discharging the person you care for have been improved?
It would be very nice if the psychiatrists could give us the time just to sit down and say, at this stage, the illness is presenting like this. We feel that she may be better off at home, perhaps doing some voluntary work. Maybe she could do a little studying if she chooses, but she will always be fragile and will need your support.
Following their discharge, what support did you as a carer receive from the psychiatrist, the team or other local services?
At one time my daughter had an excellent CPN who visited regularly and would sit and have coffee and chat to my daughter and chat to me, and we could ask any questions. That was very good. That hasn't always happened. It happened at an important stage in my daughter's life after she'd given birth and probably needed more support. And it would be very nice if that were the general pattern, which I think it's meant to be.
To help the person you care for recover, what support would you like to receive from mental health services?
Somebody to be there when it's needed. Somebody there to look after him. Which, I mean, he's getting at the home, but more visits from the social worker.
Is there any other kind of support that you would like in order to help the person you care for?
One of the problems as a carer is that you don't get a break. And it would help the carer to be more patient and sustain the caring role if they also had someone that they could lean on, or someone who could perhaps take their turn at caring while the carer had a break.
I was highly stressed out, distressed through the personal circumstances that I was going through at the time. My behaviour deteriorated, panic attacks.
Well, it all started about 15 years ago.
Called the doctors at home.
I went on a bit of
went through crisis anxiety, because things didn't improve in that way. I ended
I went up to the local drug and alcohol centre. They had a psychiatrist there who referred me to
anxiety I suffered the reason why I ended up actually
initially I went into a detox, which was followed by
I was highly stressed out, distressed through the personal circumstances that I was going through at the time. My behaviour deteriorated, panic attacks.
Well, it all started about 15 years ago.
Called the doctors at home.
I went on a bit of
went through crisis anxiety, because things didn't improve in that way. I ended up.
I went up to the local drug and alcohol centre. They had a psychiatrist there who referred me to
anxiety I suffered the reason why I ended up actually
initially I went into a detox, which was followed by
but initially I was highly stressed out, distressed, apprehensive through the personal circumstances that I was going through at the time. My behaviour had deteriorated, panic attacks.
Well, it all
So
started
my
about
mum, we couldn't find
15 years ago.
called the doctors at home.
Because of that, I went on a bit of
went through quite a
alcohol.
I was at
because
university
things
at
didn't
the time.
improve in that way, I ended
I went up to the local drug and alcohol centre and they had a psychiatrist there who referred me
due to stress, depression and anxiety as well.
I saw a
That's
psychiatrist.
the reason why I ended up actually.